Hello, everyone, and welcome to our IVF webinar. I am very happy to be back once again with all of you, and I'm sure you have lots of questions to ask tonight. And as you can see, we have another special guest with us, and this is Dr. Elena Santiago from Clinica Tambre once again. So, hello, Dr. Elena, how are you feeling tonight?
Hello, Caroline. Hi to everyone. Well, feeling really good. Thank you very much for inviting me tonight and looking forward to start a webinar.
Yes, we are definitely happy that you are back. You've done one of the webinars with us already, so thank you so much for joining once again. And my IVFenses, as you know, we have over 300 webinars available on our site. And as you know, my IVFenses is a part of European Fertility Society, and we are here every single day as we just want to support you, give you some answers, give you an opportunity to meet top fertility experts like Dr. Elena Santiago is today with us. And of course, we are here and we are going to be here because, as you probably have seen, we have many events coming up and there are plenty of topics to choose from. And tonight, definitely, we have an interesting topic, and it's identifying the fertility window when trying to conceive. So, as always, we will start with Dr. Santiago's presentation on that topic. And afterwards, I think you like this part the most. It will be time for your your questions. So of course, remember to type the questions in the chat section, and Dr. Santiago will take care of them right after her presentation. So yeah, you can type it in right now or later on, and I guess that is it from me. And let's go ahead with the presentation, okay?
Okay, thank you,
Wonderful.
Caroline.
Thank you so much. Let's go.
All right, so hello again, everyone. Tonight we're going to speak about how we can identify our fertility window when trying to conceive. Maybe we think it's something simple, but I think it's useful to go through it, explaining how the menstrual cycle works and what options we have to know when we are the most fertile during the cycle, right? So I'm going to try, most of all, to do it as smoothest and simple as possible, okay? And after, we will answer all the questions. So what are we going to talk about today? What will we cover? First of all, we are going to talk about women's physiology, and this depending on age. We are, as I said, understand better or try at least the menstrual cycle. We will be talking as well about fertilization and implantation, how it occurs. And let's cover afterwards the top topic about identifying your own window. How can we do this? We will talk about also age, because this is also important, as you know, for fertility. And we will finish with some medical advices. So first of all, we're going to talk about women's physiology. Depending on age, it's very important that you know that women are born with all their eggs inside their ovaries. This means that they won't make any new eggs during their lifetime. The amount of eggs normally is around 2 million when we are born, but about 11,000 of them will die every month prior to puberty. So we start with a very good number, let's say, but this will be diminishing as soon as we are born during lifetime. Once we reach puberty, this depends in each woman, but normally will be between 10 to 16 years. Our, let's say, menstrual cycle will start. This means that, first of all, we will talk about this later, but it's important to understand that there will be production of hormones in the brain that will do, or let's say mature, all our genital tract. This will at last achieve our fertility, starting with the menstrual cycles. And obviously, it's also a stage where there's going to be a very important bone growth. And as I say, secondary sexual characters will develop during puberty, as we know. What is going to happen is that we are going to have our first menstruation that we call menarche, and from this point later we will be fertile in each cycle. It's true that cycles sometimes will begin a little bit irregular. This depends on each woman, but as soon as we have a period, let's say that we can be fertile and achieve pregnancy. So as a teenager, a woman has only left over about 400,000 remaining eggs. From there, approximately, we will be losing 1,000 eggs each month. This phenomenon will always occur, so it's completely independent of any hormonal production. Or, for example, if we are taking birth control pills, we are going to lose as well this amount of eggs, even if there is no ovulation during the birth control pill. Also, during pregnancies, for example, we don't have cycles, but we continue losing eggs. Even if we take nutritional supplements just to try and maybe increase our ovarian reserve, this is normally not going to happen. So we are going to continue losing eggs in the same way. And health of our lifestyle could normally affect the quality of the eggs, not the amount. And also, it's very important to think about ovarian stimulation during artificial reproduction treatments, because sometimes we think that we are going to lose many eggs during the treatment because of an ovarian stimulation. But the truth is that we will lose the same eggs as in a natural cycle. So whenever the woman runs out of her supply of eggs, the ovaries will cease to make estrogens and she will go through menopause. So, I mean, having eggs means that it's going to be our fertility period. Once we don't have them, then we will have menopause and there won't be chances of getting pregnant. So it's very important to understand menstrual cycle so that we can after know how to detect or identify our fertility window. So as I said, the important or the basic, let's say, pulse for the ovaries to work will be, first of all, in the brain. There is here an hormonal production, first of all, in the hypothalamus, it's called, where we produce the GnRH, which will stimulate another area in the underneath it in the brain, which is called the hypothalamus. The hypothalamus will produce FSH and LH, which those hormones are called gonadotropins. These ones will travel around through our blood system, will reach the ovaries, and here they will stimulate the ovarian cycle, which we'll see right after with more detail. Ovaries, at the same time, once they start, let's say, working, they are going to produce also other hormones, which are like most maybe commonly known, which are the estrogens and the progesterone. At the same time, estrogens and progesterone will act in the uterus to prepare what we call the endometrium, which is the interior of the uterus where an implantation has to take place. So we'll see with a little bit more detail, as I say, at the same time, how the ovary and endometrium in the uterus work all together during a cycle. So as you know, a cycle starts when we have a period. That will be day 1. This is very important. So here, the hormonal production from the brain will produce levels of FSH and LH, more FSH normally during the first phase, which we call follicular phase, until an ovulation will occur. Second phase, it's called luteal phase after ovulation. So first phase, follicular phase, is when we have our period, we have several follicles in our ovaries. Normally, if we have a good ovarian reserve, this will be a number in between 10 to 20 follicles. And FSH, what we'll do is that those follicles, some of them will start growing until one of them is, let's say, the natural selective one. This means that it's going to grow quite more than the others, and it's the one selected to produce ovulation. Ovulation, as you know, will occur more or less at the middle of the cycle, and this is a response also to a hormonal liberation of, this time, more production of the hormone called LH. So we have a peak of LH that will produce that ovulation 24 to 48 hours after. Once the egg is released into the fallopian tube, we will see that later as well, so that you understand. Then in the ovary, there will be a follicle, let's say, left over, which we call corpus luteum. This is important because this remaining follicle is going to produce the hormone called progesterone, this yellow one. So as you see, progesterone is produced more after ovulation by the corpus luteum, and estrogens is the other hormone produced more during the first phase of the cycle that we said it was called follicular phase. So these hormones, estrogens and progesterone, produced by the ovaries, as I say, will act in the endometrial lining. Okay, this is the uterus. You know that when we have the period, this means that the endometrium lining is released. So when we have the blood of the proper menstruation, it's not only blood, it's there are lots of cells from this tissue that is completely renewed when a new cycle starts. So estrogens at start will produce the growth of this endometrium, and after ovulation, progesterone, let's say, that more or less matures that endometrium so that there can be an implantation if the egg released was fertilized. We're going to see all this in another way in the next slide so that you can understand. So we're going to talk about the fertilization and implantation so that we know what happens when the egg is released by the ovary. As I say, it will be released in the fallopian tube. It has to find here or meet, let's say, with the sperm in the fallopian tube so that fertilization occurs. And if fertilization has occurred, then the ovary will start dividing into an embryo that we call for several days while it's traveling around, well, let's say the fallopian tube. It will finally achieve the cavity of the uterus where the endometrium is, the tissue we talked about. And here, normally in a day 5, 6, 7, or even 8 of the cycle is when implantation, day of the embryo is when implantation is going to occur. So let's say that all this procedure will take for about 6 to 8 days to occur after ovulation, which will be in the middle of our cycle. The egg, it's important to know that it survives only about 24 to 48 hours once it's released. So sperm, it's true that once we had sexual intercourse, sperm will travel upwards through the uterus cavity into the fallopian tubes and will stay here for several days. Normally, it can survive around 72 hours. if we have a good sample, okay? So that's what occurs around the middle of the cycle so that we can have or achieve a pregnancy. So now, understanding all this, how can we identify our own window of implantation? So there are several ways. Let's say that the most common one and easier one, it's with a calendar. It's true that nowadays we have lots of telephone apps where we can see our cycle. It tells us when is our fertility window, but I want you to understand why this is like this. So as I said, very important that the first day of the cycle, it will be the day 1. And theoretically, ovulating cycles can be between 25 to 35 days. It doesn't have to be a cycle of 28 days so that it is ovulating cycle. I mean, there are other cycles that sometimes people say that they have irregular cycles because they are shorter or longer. But I mean, as long as we are in between that window of 25 to 35 days, starting counting always in the first day of our menstruation, then theoretically all those cycles will be ovulatory. Okay, even if we have one cycle of 27 and the next cycle of 33 days, those are ovulating cycles. So ovulation occurs around, as we said, the middle of the cycle. This could be day 14 if we have menstrual cycles of 28 days. But obviously, if, for example, we have longer cycles, then ovulation may occur later. So I think that the easiest way to understand is to take into account that ovulation occurs around 14 days before our period comes. Okay, so counting how many days more or less our periods are, then more or less we can calculate when ovulation is occurring in each woman. Okay, so here I have put you an example so that you can understand. If, for example, we have very long cycles of 35 days, it means that ovulation is not occurring in day 14. In this example, as I say, it's occurring in day 21. Or if we have short cycles of, for example, 25 days, this means that ovulation is going to take place in about day 11. Okay? So the fertility window we call are the possible ovulating days. It's not only the day of ovulation, because as we saw, sperm can survive around 72 hours. So the window is larger than only the day of ovulation. Normally we count about 2 to 3 days before the ovulation occurs, and even 2 days after ovulation. So this window is when we need to have sexual intercourse so that we can achieve a pregnancy. Other ways of identifying ovulation is not only by the calendar. Many women have symptoms that are telling us when ovulation is occurring. If we have those symptoms, if we focus on that, it's quite easy to understand when our body is going through an ovulation. It doesn't mean that everyone has to have symptoms, but obviously there are different, let's say, clues that can tell us when ovulation is occurring. So we have to know how to detect them. So for example, some women can feel abdominal pain, such as, for example, or similar to a period. Sometimes it's a little bit less of pain, but obviously there could be feelings over there. Other symptoms could be, for example, an increased vaginal discharge, which will be more transparent than in other times of the cycle during that fertility window. And also, naturally, it's curious, but this is how nature works. The libido will be increased. So this means that we will probably want more to have a sexual intercourse than at other times of our period, of our own period. So sometimes maybe this is something unconscious, but obviously it's happening during ovulation in our bodies. And also other things that we could try to detect is that our basal temperature will increase during ovulation days. And the third way of trying to identify our window can be doing the what we call ovulation tests. These tests are very easy to achieve, very cheap, and very easy to do because they only need a urine sample, so we can do that at home very easily. And when ovulation occurs, we will detect a red line shown here. This means that ovulation will occur between 24 to 48 hours before we detect the positive ovulating test. My advice is that if we start doing this type of tests, they have to be done minimum once each day at the same time, but it will be better to do them maybe in the morning and in the evening so that we can be able to detect the positive. It's recommended to lead sexual intercourse when maybe symptoms are not so clear. As I say, it helps to detect the exact ovulation. But this is important that you know it doesn't increase the pregnancy chances when comparing to women that don't do those tests. But sometimes it can help us to detect the window of implantation, okay? Oh, sorry, the window of fertility, of ovulation. And well, as I told from a start, we are going to talk as well about age, because this is not only trying to identify the ovulation to get pregnant, we also need to be very, very aware that age is very, very important for pregnancy chances. So as you see here in the fertility timeline, ages between 18 to 24 will be the best ones to be pregnant, let's say the easier ones to achieve a pregnancy. Ages between 25 to 30 are good as well, but from 30 years old onwards, this could be much more difficult, not only because we have a lower ovarian reserve, as we talked about, but as well because the eggs that will be left over will have much less quality than before. So obviously chances of pregnancy are going to diminish within age. So here you have another example so that you understand the impact of age in fertility. The likelihood of getting pregnant, as we said, is going to be very high around our 20s, but this is going to diminish a lot from, for example, 35, 40 years onwards. So likelihood of infertility obviously will increase in the other way around with age, okay? This doesn't mean that each cycle we have 86% chances of getting pregnant. Okay, it's important to understand also that the human being is not a very fertile organism, and our maximum chances of getting pregnant are about 20% for each cycle. This is more a percentage of achieving pregnancy during, let's say, a full year. Okay, so it's important to know that when looking for a pregnancy, it's not so common or easy to achieve that pregnancy in the first month. Sometimes we have to try for several months to achieve it. So let's talk about medical advices regarding the fertility window. When trying to conceive, it's very important that we are aware of our cycle, but also it will be important not to get obsessed with it. So we have to let nature act as well. As I said, even libido is going to increase during ovulation days, but well, it's better to be aware of our own body, so that we know we have more information, and maybe we could increase chances, obviously, in getting not sexual intercourse in the exact days. Even they say that having this sexual intercourse 2 to 3 times per week will be enough to complete the chances of pregnancy that I talked about. So even if you are not focused in only the ovulation days and you have frequent sexual intercourse, this, if there is no fertility issue, should be enough to achieve a pregnancy. The maximum probability of success, as I said, is the 20%. We have to be very aware of this for each cycle. And this will be diminished a lot starting from 35 years old onwards normally. So if you are right now less than 35 years old, you can try for a year to achieve a pregnancy. If finally you don't achieve it, then you have to see a doctor so that we can do some tests to check that everything is all right. This same advice for women older than 35 years old means that they can try naturally for about 6 months, searching, and if not, see a doctor afterwards. If you think you will be a mom, this is also very, very important. If you really know that you want to be a mom later than 30 years old, then take into account that you can freeze your eggs during your 20s so that you don't waste time later trying pregnancies when you are too old and there are no more options and no solution for it. So if you know that you want to be a late mom because of your circumstances, then you have to know that you can freeze eggs to be sure to have good eggs of good quality frozen, so that when you are older you can use them and obviously have better chances than maybe naturally at that time. And well, to finish today, I want to put down some ideas to take home. So it's very, very important to be aware of your cycle when trying to conceive, knowing our body, as I say, not getting obsessed. Be aware, this is very, very important, of your age chances, because if we are not in our 20s, maybe we are in our 35, 40s, then maybe we have to try maximum for 6 months, and if not, search for some help, okay? And identifying your fertility window, following a calendar, symptoms, and checking with ovulation tests may help so that we can have, let's say, the greatest chances of getting pregnant. So this is all that I wanted to talk about today. Hope that you understood a little bit more about the menstrual cycle, how it works, where is our fertility window, and obviously I'm open to answer all your questions right now.
And wonderful. Thank you so much indeed for your lovely presentation and explaining all those steps, because sometimes it definitely sounds so easy, but of course, there are some things that we are still missing, I guess. So thank you so much for that. And yes, you are right. We are now off to our questions. There are some questions ready, but of course, if you have anything else you would like to add, go ahead and type those in right now. And let's start with our Q&A session. Okay, Dr. Santiago?
Okay.
Wonderful. Thank you so much. And let's have a look. The first question is from Karen. I used a digital ovulation test and have noticed an LH surge 1-2 days before my period arrives. What could cause this?
Oh, but it really is your period, because it's true that sometimes there are women that during ovulation could have we call a spotting, which is a little bleeding during those days. So maybe you are counting that that's your period, and it's not. It's ovulation, and your period will come 2 weeks after. Maybe is this. If not, LH surge doesn't happen before your period. So I don't know if this is working correctly for you right now. Sometimes also you can have LH surge if you are getting a pregnancy, and afterwards that pregnancy doesn't work, and we call it biochemical miscarriage. So maybe if it's not as spotting as I told you, you have to, or my advice is that you ask a doctor to help you with this LH surge.
Okay, thank you so much, Karen, for your first question and your answer to that. And let's have a look, okay? We do have next question from Kat. What do you think about fertility tracking apps? Do you think it is useful and worth to use to track my fertile window? Is there any app that is better than the other?
Okay, honestly, I don't know about apps, Kat. Sorry about that, because there are millions of them, and I think that they are different in different countries. But I think it's good. Normally, they are quite exact. Even if you have, let's say, not so punctual cycles, they can help you to detect that window of fertility that we've spoken of. So yeah, it's good. Also, it helps you to remember when you had your last period, so that you more or less calculate also by yourself when it's your window of fertility, and in that way as well you can always check that you are more or less regular, that you're having periods every month. So yeah, I think they are useful to help us.
All right, thank you so much for that definitely interesting question and for your help with that as well. And let's have a look at the next one from Tanny. I had few cycles of 22, 23 days. And do you mean that I didn't have ovulation as they were less than 25 days, as you mentioned?
Okay, Tani. Yeah, maybe you have not always, but maybe some of your cycles are not having ovulation. This is not exact, as you know. It doesn't mean that with 24 I don't have ovulation, but with 26 I do have. Okay, but yeah, sometimes it means that shorter cycles could be anovulatory. So in your case, it will be very, very good to check an ovulation at the half of the cycle, as we mentioned, with an ovulation test, if you're getting these shorter cycles, just in case, so that you know that everything is all right.
Okay, wonderful. Thank you so much once more for yet another question. Okay, and now I will go to the question from Karen, as it is a follow-up. Okay, and I will of course go back to the previous ones. So here it is. I have had 2 IVF cycles, and following this both times, the next 2 cycles are 14 days apart. So it would make sense that I have LH surge and should be ovulating, but then 1-2 days later, I have a real period rather than spotting.
Okay, I have 2 cycles. Okay, Karen. So, sorry, because I was reading again your question. I didn't understand correctly, but I do understand it right now. So, maybe you have to check as well with the doctor, because sometimes also if you're having a real period, it's important to check that you have good progesterone levels during the second luteal phase we talked about, because sometimes you have ovulation, but afterwards maybe your ovary doesn't produce enough progesterone, and this means that a period could come because there is not enough, let's say, hormone to sustain the endometrium in place and you get your period. So ask a doctor about this, maybe to check your progesterone levels in the luteal phase after your LH surge.
And excellent again, thank you so much. And there's actually a thank you from Karen for you. Here it is. And let's have a look at the next question from Ella. Definitely interesting question as well. Let's have a look. My mom had last period at age 55, and I've heard in one TV program that this would indicate that my last chance to conceive naturally is around 10 years from that time. I wonder if you know any studies to confirm that.
Okay, Ella, it's true that our inheritance is important. For example, for our date of menarche, starting period, or our date of menopause. So maybe we have it similar to our moms, but it doesn't mean that 10 years before her menopause is, let's say, the final timing where you can get pregnant. So this depends more on your ovarian reserve. And as I said, even if you have a very, very good ovarian reserve with 45 years, which I've seen patients with very good ovarian reserve, it exists. It's not common, but it does. You have to take into account that within those ages, egg quality is going to be very, very diminished for absolutely every woman. So obviously this is not impossible in achieving a pregnancy from 43, 44, or 45 with 43, 44, 45 years. It's not impossible, but it's very, very difficult for absolutely everyone. So I mean, we don't have a timeline in that way. It's better to see what's the situation, what's the actual situation with a fertility study that we call, seeing our anti-Mullerian hormone and antral follicular count to know more to know more about our ovarian reserve. But unfortunately, there are no tests that can check egg quality. Okay, this is a problem. But as I say, we have to always think that from 40 years onwards, 42 years onwards would be like the last period of timing of good quality eggs. So with 45 years, it's normally very, very difficult because of quality, even if your man had a late menopause.
Amazing. Thank you so much for that as well, of course. And now we will go to the next question. And for now, at least, it seems that might be our last question. But of course, if you have anything that you would like to add, you know what to do. And let's have a look. It's a short question. Is it normal to have periods twice a month?
Okay, Kat, let's say that it's not the normal. As I said, normally cycles will be between 25 to 35 days. So if you're having twice a month of your periods, sometimes this could be telling us something, such as, for example, that we could have a low ovarian reserve right now. I'm not telling you that you have this, but obviously it's something that maybe we need to check with our gynecologist, so that we can see whether everything is all right, meaning hormonally, and having a good ovarian reserve. Because it's true that before menopause, even years before, we can get these irregular cycles, meaning getting periods twice a month, or even having a period 1 month, 2 or 3 months without a period, and then comes another. So I mean, sometimes irregular periods could tell us that hormonally there is something that's not working correctly, or sometimes it's telling us that we are heading in some years menopause. But I don't know more about you, so I mean, I'm not telling you about that you have a low ovarian reserve. I'm just telling you that it will be good to check it with your doctor, just to be sure that everything is all right.
No, of course, understood. Thank you so much for that advice. Two more questions have shown right here. I will
Okay.
go to this one as it is about period. Sorry, what length of the period vary? Why? Plus, minus 2 days.
Okay, because as we've explained, this is not an exact science. Biology never is. So things happen as I explained. Hormonally, there needs to be a stimulation. After that stimulation, has to be a peak of LH, an ovulation, and this could vary. So I mean, as any other procedure in our bodies that could vary, this is the same. It doesn't mean that having one menstrual cycle of 28 days and the next of 30 days is something unusual. It's the most normal thing. So don't worry about that because biology is like that, okay?
All right. Again, thank you so much for yet another advice here. And let's have a look. Okay. One more question. Is the maximum age of 50? You can have IVF at 50. And can you be 50 or less to start IVF? Sorry.
Okay, Tani. So, I mean, for IVF, there really isn't a maximum. Normally, clinics give a maximum because, well, of chances, obviously. Normally, even IVF with own eggs, maximum should be around 45, 46 years when we have good ovarian reserve. Honestly, I've never seen an IVF with women around 50, only egg donation treatments. But I mean, if we put limitations, it's not because we're not having periods, maybe with 50 years old onwards. These limitations are more because of risks that could be due to age during pregnancy. So, I mean, we have always to put a limit, and like 50 years old, we think it's enough, or let's say too risky afterwards to have a pregnancy. There could be problems there. So obviously that's why normally we put the limit over there in 50 years old.
And there's a follow-up from Tani.
Yeah.
If with egg donation, yeah? So
Yeah, egg donation could be done always. I mean, even women in menopause could go through this treatment with very, very good chances of success. So, as I say, it's not something that biologically can't be achieved onwards. So, if we did treatments with egg donation for example, a woman aged 55 years or even 60, this could work because we give hormonal treatment so that the uterus is prepared, even if the ovaries are not working there because we have a menopause. The hormones that we give for the treatment are going to work and there can be an implantation there. But as I say, the limitations are normally because of the risks during pregnancy from 50 years onwards. So we have to take into account that, for example, premature delivery could occur, preeclampsia, which is a very severe illness with hypertension, is very increased during these ages. This could give problems to the mother as well as the baby. And also, I'm sure you heard about just diabetes during pregnancy. This could be also a problem for the baby. So, I mean, we give limitations because of these issues.
and fantastic. Thank you so much for yet another
Welcome.
great question, of course, and your help. One more from Ella here, okay? And of course, thank you from Tani for your explanation.
Thank
And the
you.
question is here. I was told by my doctor that I have total of 14 follicles visible in last checkup. I am 40 and have kids. My grandma and great grandma gave birth to last child at the age of 44. Is that that would mean I have greater chance than average for live birth.
Okay, at first, as I said, inheritance is important, and it's true that maybe you have more chances than other women to get pregnant because of these events in your grandma and great grandma. But obviously, as I say, the situation of each person is always different. So obviously, for every woman getting pregnant after 40 years old, it's going to be more difficult. I'm not saying that's impossible, but obviously it could be more difficult for you too because of age. But obviously, maybe your inheritance means that, for example, you have a good ovarian reserve. As you tell me, 14 follicles is very, very good for your age. Quality is the other issue that we have to take into account. So maybe, well, you can achieve it, okay? But obviously, I'm not a futurist. I can't say that you obviously can achieve it. My advice is that if you try, as I said, for 6 months naturally and you don't achieve that, even if you are a mother, then my advice is to go and search for help for an IVF treatment, probably that could increase chances for you to get pregnant.
And thank you so much yet again, of course. And at least for now, I mean, someone is typing, so let's see if we have another question. If not, we will be finishing. But as someone is typing, I just want to make sure whether it's a question or just a thank you. And before I let you go, anything else, Dr. Elena, that you would like to add?
No, thank you very much for all your questions. Hope that obviously today has been useful for you to, well, not only identify your fertility window, which was the topic, but also to understand more about our, as I say, own body, our cycle, how it works. And obviously, I'm delighted to be here with you. So please ask me whatever you need.
Excellent. Thank you so much indeed. And in the meantime, one more question. I think two actually more questions are here. So let's have a look. I also have many women in my family who gave birth naturally over the age of 42, 43. I don't understand why women over 40 are told to be too old.
Okay, Margie, I understand you perfectly because I mean, I have patients every single day from more than 40 years old with the same problem. I'm not saying that we can't achieve a pregnancy. I'm only saying that it's going to be more difficult. So it's not that we are old. I mean, nowadays, 40-year-old aged woman is very young, okay, because we live much more years than before. But the problem here is that our own biological clock, let's say, didn't change within the society. So that's why we say that with 40 years old, we are a little bit old, or we have less chances of success. This is something that for the moment can't be changed if we want to use our own eggs. And as I say, maybe you can have a pregnancy, but obviously if it's been difficult, as I said, my advice is to try for a treatment before it's even very late.
All right. Again, thank you so much for that. Okay, let's have a look. Mary has also added one more question. So, how many attempts can we do with egg donation? I had one that didn't work and was wondering if I should try more, and how many.
Okay, so I mean, there is no limitation here. As I say, normally limits are within age. You can try many attempts. But obviously, normally, when you've been through, for example, 2 embryo transfers that didn't work with very good quality embryos from a donor, egg donor, sorry, then we will have to see if there are more issues. Normally, it means that we can ask for more tests regarding maybe the uterus or regarding your blood clot, if you have a problem with blood clotting, so that we can see whether there are other issues that could affect implantation here. So, I mean, there is not a maximum. You can try as many as you can want, or even well, this is something psychological also, so psychologically very difficult. So we always have a limit. Each person has a different limit. So medically, let's say that the only limitation would be age. But obviously, I recommend you, if you're going ahead with another treatment, maybe to watch out for other things that weren't done before, and that could maybe say that we don't have here an implantation failure problem.
And amazing. Again, thank you so much for that explanation. Again, there's a thank you also from the previous patient and from Mary. Understood. Thank you so much. Okay, Karen has added one more. Okay, so let's have a look at it. If after 3 years of trying, I've only had 1 twin pregnancy, which didn't progress after this length of time, what is the likelihood of it happening after this length of time? I started at 39 and now I'm 42. With these numbers, it's only about 1%, which seems very low.
Yeah, Karen, I mean, it's very difficult to know your exact percentage, but obviously we are around that because of the egg quality, as I said. So here, this means that most of the embryos that we can achieve naturally or even during an IVF treatment could be abnormal chromosomically. So this means that obviously chances of getting pregnant are going to be much lower than before, and even miscarriage rates are going to be higher. So, I mean, I can't tell you your exact percentage, but my advice is that if you've been already 3 years trying and you didn't achieve a developing good pregnancy, then you have to probably do a treatment to increase your chances.
And once again, huge thank you for that advice as well here. Okay, and I believe we will be finishing for tonight. It's possible that it's our final question. Again, someone is typing, so I just want to make sure that we will not miss any of the questions. But of course, in the meantime, I just also want to mention that if you need any if you have any other questions or would like to get in touch, you know that you can do it. And I'm sure that anyone at Clinica Tambre, the whole team, will be happy to help you out. In the meantime, Karen has added a follow-up. Okay, so is the treatment IVF? It's from the previous patient.
Okay, yeah, Karen, probably it will be, okay? I mean, for example, insemination normally is not an option from 38 years onwards. So I think that the option obviously will be IVF, but we would need to know much more about you to give you the best advice. But normally, yes, that will be the treatment for you.
All right, perfect. Thank you for the clarification. And one more from Margie. Is it better to have 12 eggs in a cycle or 4 eggs in 3 cycles each? Just asking because of quality.
Obviously, the greater the number of eggs in one cycle should be better. I mean, we could always accumulate eggs to have better chances, meaning to have more embryos in an IVF treatment. But normally, it's true that not only age, ovarian reserve sometimes If it's very low before time, sometimes means that the quality could be worse than maybe the age is telling us. Okay, so I mean, the better the response to a treatment, normally, not always, okay, the quality should be better than maybe, or at least chances obviously are going to be better than in a treatment where we're going to achieve less eggs.
All right, again, thank you so much indeed. And actually, there are two, maybe not questions, but I want you to see. Mary has added, yeah, I forgot to mention that I'm 44, and I was asking about the number of time I can try and until which age. Thank you, Mary. Of course, I think that it's clear now. And also, Karen has added, definitely interesting. Thanks. Just checking in case there was some miracle treatment I haven't discovered.
Yeah, okay.
Thanks so much, of course. Okay, and so one more. Okay, let's have a look. Is it just biology, and we don't know when in a cycle we can have good eggs or not?
I mean, normally quality is constant. It doesn't mean obviously that all eggs are going to be the same. But if we can have a general idea, normally if we have a bad quality, this is going to be this way, similar in all cycles. And if we have good quality, it should be that way. This is biology, as you say. So obviously, we could, in a person with very bad quality eggs, we could always achieve a good egg that develops into a good embryo and obviously into a developing pregnancy. But I mean, if we have to try to achieve this, and sometimes if we've been through many treatments and the quality is always bad, then maybe the advice is to change the egg, for example, with egg donation. No? So I mean, there is no treatment for quality here. That's the difficult part.
Yes, and thank you so much yet again, of course. And we will be finishing for tonight, but thank you so much, everyone, for joining. I am very happy that we are bringing those topics, and I see so many questions, and it's definitely wonderful to be able to see it. Trust me. And Dr. Santiago, thank you so much for joining us again, and of course for your help, because as you can see, many things are coming up your way as well. So you can see here. And before I let you go, you need to see those thank yous, right? So thank you so much from Mary, and also from all the questions, good answers. And there's thanks so much here as well. Okay, so as always, remember it has been recorded. So if anyone had to leave earlier or anything like that, don't worry, you will be able to watch this. It will be available tomorrow on our YouTube channel. Just go ahead, subscribe. That way you will be notified when the new video is uploaded. But also remember, we are going to be here tomorrow at 8 p.m. UK time, another topic. So just go ahead and register, and I hope to see you tomorrow right here as well. And Dr. Elena, until our next event, just like that, okay?
Okay, sure. Thank you so much, Caroline.
Well, have a lovely evening, everyone, and well, see you tomorrow. Thank you. Bye.
Okay, thank you. Bye-bye.